This is Local Matters on CBS 17 News at 4.
More than 500,000 people in our state remain uninsured as lawmakers can't agree on something they have to do every year.
The General Assembly voted earlier this year to approve Medicaid expansion, but made that a condition of the new state budget. CBS 17's Russ Bowen joins us. Russ, you sat down with the DHHS Secretary to find out what the plan is moving forward.
Once Medicaid expansion launches, it will bring much needed relief to around 600,000 people. I spoke to NCDHHS Secretary Kody Kinsley about a very important deadline that is fast approaching. It took a long time for North Carolina to finally catch up to many of the states in this country as far as Medicaid expansion is concerned. But we're not there yet. Part of the agreement within the state legislature meant that it was tied to this year's budget. We're not there with the budget either, and we've got a big deadline coming up very soon, correct?
We had geared our work at the department to implement expansion around June 30th, which is when we expected the budget to pass and therefore authority to be given for us to move forward. It was a little bit like arriving at the airport and the plane wasn't there. We were ready, the bags were packed. And so we've been working at the department to figure out how do we keep the work moving forward without that thumbs up from the General Assembly. And that's why we've crafted this strategy to go ahead and set the public date, to do the notice and comment work that we have to do that the federal government requires, consultation with our tribes to get their input, training our partners to get them ready to do it, and get the public geared around October 1 as a go-live. By us going ahead and doing that, we're able to shift what would have been about 120-day lead time from that authority given to only 30 days. So as long as I have a thumbs up from the General Assembly, one way or the other, budget or by decoupling that authority requirement, by September 1st, I'll be able to stick the landing October 1st.
What happens if you miss September 1st?
If we miss September 1st, we'll need to redo a bit of the work. We'll have to re-communicate to the public. Our current expectation is that the earliest we could go live at that point would be December 1st. But it could slip into 2024 depending on how far it slides. But look, we don't want to miss that date. I hope the General Assembly will give us the thumbs up to move forward. Lives depend on it. October 1st isn't just the day we'll start to accept applications for expansion. On October 1st, about 300,000 people in North Carolina will all of a sudden have coverage, full benefits on Medicaid, because we will have moved them from a current limited benefit, our family planning benefit, to full Medicaid on that date.
And you mentioned, this is about people's lives, and it's a matter of life and death for some people.
Right now, every month, because we've been going through an unwinding process from the public health emergency, we have about 9,000 people who had coverage, who are losing it, who would have been able to stay on if expansion was in place already. That's a real loss. So people who have medications for their blood pressure, or people who have their diabetes medication and they have those chronic diseases under control, those benefits are no longer covered. They can't go to the doctor anymore. So not only do we have people in North Carolina that don't have coverage, that are trying to figure out how to navigate it, we have people who have had coverage, who finally have their healthcare challenges addressed, and they're losing it. And that's very scary for those folks. Who these people are 80% of people that will benefit from expansion. It's about 600,000 people. 80% of them are from working families. 30 to 40% of folks in rural communities are uninsured. I think about small businesses in vibrant rural communities in North Carolina. They do important work. They make their towns attractive for us to visit. They offer services to their community, but they can't afford health insurance for their employees. Those are the employees that will get coverage through expansion. It's great for them and their families, but it's also a healthy workforce for those small businesses and vibrancy for those communities.
I think it's also important to remind people, too, that these are federal dollars. The vast majority of the money that we're talking about to fund Medicaid expansion in North Carolina, this is money that we've given up over the years. It's not coming out of every individual's, tax bill at the end of the year when they pay their state taxes.
Right. So this is drawn down. Those $8 billion that are coming from the federal government are exclusively from the federal government. There is no additional cost to a state taxpayer to make this happen.
When you mentioned that you're working with the GA and that you're doing everything you can, what does that mean specifically? Are you have to send folks down there every other day to say, hey, what's up?
I approached the General Assembly as we started to slide on the budget negotiations and said, I want to try to think about how we save time, how we don't lose it, how we still get this in place fast. We've figured out a strategy to do that, and credit to my team for being very thoughtful and creative. We negotiated that with the federal government, and they didn't have concerns about us moving forward in this way while they continued to negotiate the budget. And I want them to be negotiating because there's a lot of things in that budget outside of expansion that I want to get done. I just believe in implementing things in a smart way. It's a little bit like Thanksgiving dinner. It's a lot of complexities, a lot of things to do at once. What I'm proposing is that we're going to bake the pie a couple days ahead of time and stick it in the freezer and be ready to shove in the oven the morning of, and still everything comes out on time.
And we don't want to end up with a dry turkey.
No dry. We're brining the turkey.
That's right. So earlier today, we also talked to Senate Leader Phil Berger, who gives us his take on where things stand right now when it comes to the budget and Medicaid expansion. And guys, of course, this is something we're watching very closely. It can change day by day, but there are a lot of people who are hoping they get this done so this gets launched on the date that they're hoping that it can, October 1st.
Yeah. All right, Russ, thank you so much.